Hi, I'm Erin Petersley, your Kansas Farm Bureau Health Plans Manager, and today we're going to talk about Medicare Part D. Medicare Part D is the prescription drug program and is the most recent addition to Medicare coverages. So when we talk about Part D as the prescription drug program, one of the things that I want you to remember is that Medicare Part D is a dance. We're going to pick our best partner, we're going to use them for the year, and then every year we're going to check to make sure that they continue to be our best partner for us. So when signing up for a Medicare Part D, you must have Medicare Part A and or Medicare Part B. You have to live in the plan service area. You can't live outside of the United States. You can't be incarcerated. And you have to enroll in a Medicare Part D plan to avoid the penalty. In most cases, this enrollment is not automatic. So you have to do one of these plans if you want to avoid the penalty unless you have that credible coverage. So let's work through a couple examples with that. Let's say I'm 65 years old and I am going to continue working. I have coverage through my employer. My health coverage is through my employer. And every year I will get a letter that says your coverage is either credible or not credible. So if I get the letter and it says, hey, your coverage is credible when it comes to Medicare prescription drug plans, then I don't have to do anything. I can continue with my health plan. And when it's time for me to retire, give up that plan, I can enroll in a Part D without any issues whatsoever. But I could also get a letter that says your coverage is no longer considered credible when it comes to Medicare prescription drug coverage. And at that time, I must select a Medicare Part D plan for me to avoid that penalty. Should you go ahead and take the penalty or how you should handle that? So let's say I'm 65 years old. It's time for me to go on Medicare. I need to pick up all the pieces because I do not have employer health coverage, but I don't take any medications. Well, you still have to take the Medicare Part D plan to avoid the penalty. Okay, so you can choose to not pick up a Part D and know that you're going to have a penalty that accrues. And maybe 5 years down the road, you start taking medications, you will be assessed a penalty. And that penalty, there's a formula to it, so it can change. There's a whole bunch of pieces to it, but that penalty is then going to be added on per month forever. Okay, so maybe you accrue a $20 penalty over the course of 4 or 5 years of not having the Part D plan. They're going to take that $20 and you're going to have that penalty that's added on to your monthly coverage, Part D coverage, every month for life. So that penalty adds up really quickly and there's no way to just pay a set amount and be able to go on down the road. So you really do need to assess whether or not, which is more beneficial for you to pay a penalty later on or to just pay it. So those are just decisions that you have to make in regards to your medications, but know that it is a required piece or you do face a penalty. So when you enroll in a Medicare Part D plan, you can do it during that 7-month initial enrollment period, which is 3 months before you turn 65, the month you turn 65, and the 3 months following your 65th birthday. But you can also change plans every year, October 15th to December 7th. And I would very much encourage you to be a good consumer and to check out those plans every year because formularies change, the plans offered change, the premiums change, what your pharmacy is accepting, your medications change as well. So all of those changes make it very beneficial for you as a consumer to check this out every year. And there are other special times that you can join, but that is going to be based on your circumstances. So how do you choose that plan, Part D plan? Things that you need to compare are the premiums, the drug coverages, deductible, co-insurance, the gap coverage or the donut hole coverage, the step therapy, prior authorization, and quantity limits are all going to be things for you to compare and to really make that decision at the end of the day. Again, October 15th to December 7th, I cannot stress those dates enough. It doesn't matter how those dates fall on the calendar, those are the set dates every year for you to be able to go in and check. So when you want to do this, you can call or do this by computer. Doing this through Medicare.gov is where you will find the plan finder. Very user-friendly to use in terms of going to Medicare.gov, finding the plan, put your information in, and then it will show you what your costs are based on the pharmacy that you selected and based on your medications. You can find a SHIC counselor, a senior health insurance counselor for Kansans, that will help compare plans. These are individuals that are trained and educated and in our communities all throughout the state of Kansas, and also by calling 1-800-MEDICARE. All of these people, websites and telephone numbers can also help you actually enroll in the plan. Other ways that you can enroll in the plan is by going to that plan's website specifically, or working and calling them as well. So resources that are really important to use here, Medicare.gov. They're going to be your best source because they're going to have that tool finder. ksinsurance.org is also a great resource, ssa.gov, and your senior health insurance counselors for Kansas, they can be found at kdads.ks.gov, and again, are just great people to be able to help walk you through this process. If you have more questions, please feel free to reach out, and you can send me an email at kfbhealthplans@kfb.org, or feel free to visit our website at kfbhealthplans.com.